Welcome back to Inside Vision. Guest hosting this morning, Holly Rush, on Episode 6, The Road to Reopening, featuring perspective and insights from Warby Parker's Neil Blumenthal and Dr. Pratil Lau. And now, from New England College of Optometry, your host, Dr. Howard Purcell.
Hello again, and welcome to another episode of Inside Vision. I'm Howard Purcell, and along with Eric Lilligren, we're proud to bring you Episode 6, What, When, and How, The Road to Reopening and Beyond. We're so happy to have you with us again for another episode. You know, it's been an interesting week since we met last as we continue to see progress being made on the reopening of practices and businesses throughout the country. And it's really been an interesting experience in many ways as I've had a chance personally to come back to our clinics and our physical facilities, and really interesting in chatting with people. I have found that there's very strong opinions that people have. It isn't sort of this sort of neutral position. It's kind of one way or the other. You either feel really strongly about coming back and we need to come back and we need to make that move, or you're feeling like, you know what, I'm going to take the road of caution. I have to be cautious, et cetera. You know, we typically see bell curves with things. And I think in this situation, we're really seeing two peaks on either side. And it's been quite interesting for me to see that. And, you know, perhaps that has to do some with the political environment, et cetera. But the reality is we see a lot of differences in terms of opinions on wearing masks, on participating in activities, et cetera. And I certainly can appreciate that. It sort of appears and feels to be a little bit of this health versus wealth kind of discussion. We're all focused on making sure we keep ourselves healthy, our families healthy, our friends healthy, and people we're going to engage with. But on the other side, I think we can appreciate the fact that there's a financial position here, a financial issue that exists here that we have to balance. And it's that balance that I think we're all truly trying to create. In this environment, it's important that we think about our customers, our patients, just like we would thinking about our family. And as I've had these discussions about the health versus wealth side of it, I think in the end, it truly comes down to, as long as you're focused on treating people the way you would want your family to be treated, protecting them as best you can, making the efforts you need to sanitize, et cetera, and make people feel comfortable coming back to businesses, I think in the end, we'll see some really positive things. We have a great show for you today. My colleague and partner in crime, Eric Lilligren, is out in the field in South Florida, and we're going to go out to Eric in a little while to hear from him. He's been traveling around the country for the past almost 4 weeks now, and give us a really interesting perspective. But I am absolutely thrilled to welcome back Holly Rush. Holly's going to be my co-host today, and as many of you know, the contributions Holly's made to this profession and this industry have been significant. She's one of my favorite people and a real creator and innovator and true entrepreneur in many ways, and very appropriate to have Holly with us today. So welcome to Inside Vision again, Holly. So happy to have you here with us.
Thank you, Howard. It's always fun to be with you, and I know you've got a great show lined up. I'm looking forward to doing this.
We do have a great show lined up, and I'm so thrilled that you're here. When you were here last with us, you introduced a couple of interesting programs that you were looking at. I'd love to have you share that with some of our listeners. But before we do that, tell us about your own personal experience. I mean, we're all having those experiences of getting out there and trying to at least begin to re-immerse ourselves into the world again. And clearly it's a staged process, but a little different everywhere we are. I know we're all jealous where you are today. We know you're down in Key West, but spilled the beans.
That was supposed to be our secret, Howard. Not so secret anymore.
All right. Well, sorry about that. But anyway, I know you've traveled a little bit. You went down to
Absolutely.
From Northeast Florida. What have you experienced? What's life been like for you, and what have you observed?
Yeah, so I mean, for the most part, we've been very isolated. We haven't taken a lot of risks. I would say it's been mainly, the grocery store run and back, and that's pretty much been the extent of it. And even that, I'd say, as a consumer, is a little bit unnerving because, as we were talking about offline before, the compliance around PPE and safety and sanitizing the environments, it seems to be very inconsistent. And obviously a lot of retailers and businesses are allowing their shoppers and consumers to sort of make their own decisions about protection, which I understand on one level, because obviously it's tough to engage in those conversations or force people to do something that they don't want to do. But on the other side, as someone who wants to comply and stay healthy and keep other people healthy, that aspect is a little, I would say, unnerving. We did travel down here. We did about a 7-hour road trip from, Central Florida down here to the Keys. And again, you see, as I'm sure we'll talk about, a very, very mixed bag. In some areas, it seems like, it's still very, very quiet. Traffic is very, very low. In other areas, you really start to see this sort of burst of activity. And again, lots of people sort of engaging as though nothing's really happening. We're kind of back to the old way of things. I had a chance just before I came down here on Monday this week to go to my eye doctor in the town that we live in, which was interesting because I knew that we were talking this week as well, and just observing a lot of the protocols and what was happening within that practice. I think they were thrilled to be open.
I think Holly froze on us a little bit there. Holly, we're going to have you back there in a second, I hope.
Absolutely. Sorry, can you hear me okay?
Yep, we got you back again.
Okay. So in my own eye doctor's location this week, just seeing again a little bit of a mixed bag. And one of the things I was talking to one of the opticians about is what's actually happening in the dispensary area. Obviously, you have hundreds of frames on the frame boards. You have a desire from the patient to want to pick things up and try them on. And she said that's actually probably one of the biggest bottlenecks that they're experiencing right now is keeping those frames sanitized and then putting them back on the board. So I would imagine for a lot of practices right now, just rethinking the flows and the processes within the practice is really going to be key. And until you're open, you're really not going to know where those bottlenecks are.
It's such a good point. And the good news is that people should be assured that these type of activities are taking place and we're doing what we need to do to minimize the risk. But at the same time, you're right. It's all over the place. And, I think if I'm a consumer and I'm out there and I'm trying to consume goods these days, I'm going to be very critical of how people handle the disinfection and that they're at least paying attention to that. Mm-hmm. And we see great examples of that all the time. So, Holly, while we have Eric here, maybe we'll flip over to Eric. I know that you did your 7-hour journey. Eric's done almost a 4-week journey across the country. Eric, are you there?
Yeah,
we love you.
Yep.
There you are, buddy. Can we see you? I don't know if we're going to get a chance to see your face there or not.
Well, Howard, yeah, thanks for the thanks for the opportunity. I'm laying low because, as you know, before the show, we had some interaction with local authorities and said that we're not exactly in compliance to be broadcasting from here. So I just have the camera up above my head, sitting on a chair. They just kind of think I'm waiting to go live. So you're
causing trouble everywhere you go, buddy. Is that what you're
No, I'm not causing trouble.
Hey, listen, tell us about your journey, though. I mean, Holly was starting to discuss a little bit of hers, but you've been out there 3.5 weeks. You started up in New Jersey, you made your way down to Florida. Over the past 3.5 weeks, what have you observed? What are you seeing? Are things evolving? Do you see a discrepancy like Holly was mentioning? What are you seeing in your journeys that could be helpful to us?
Well, first of all, I'm surprised that Holly's in Key West. I didn't know. Did you say Key West? Is that where you are, Holly?
That was supposed to be a secret, apparently, but that's long since passed.
Oh, well.
All right. All right. So I guess that's blown. But I guess between the two of us, we have the state covered because I came from the West coast the other day over to, I'm in Delray Beach now. I came from Naples a couple days ago. I've been working over here for a couple days. But there are a lot of different aspects of this whole thing. Are you curious first about optometry in those locations or in general? What would you most like to hear about?
I know, start off in general, just telling us what the experience has been like. And then I know we were with you last week in one of the practices down in South Florida, but overarchingly, what has the experience been like?
Illuminating. I mean, just moving south, it was gradually more open. I got to Valdosta, Georgia. I guess that was a week ago yesterday, correct? So that was Tuesday. Yeah, I got there Tuesday for the show on the 5th, Cinco de Mayo. And that was interesting because the morning, as you saw, oh no, wait, that was 2 weeks ago, right?
Yeah, because
2 weeks ago.
Today's the 20th, buddy. You've been traveling for a while.
No, it's been a while. But so that was the 4th and the 5th. And when I got to Valdosta, I was just amazed because I'd been in New Jersey for 6 weeks, buttoned up at home and, trying to support my local restaurants and knowing that they're suffering and, not using gift cards that I had and just like you can see the pain everywhere with local businesses. I mean, even in New Jersey, I was I was out and about most of the time working with you, Howard, putting this show together, and if not in my basement. So I was in my car in my basement for a good 6 weeks before I just said, I got it. The optometry was opening in Valdosta, Georgia, and the Wilson Eye Center there was miles ahead as far as I knew. That was the point that I got from one of my colleagues in Conyers. And he said, go check. As a matter of fact, that my colleague actually had coronavirus. I would have gone to his practice, but he had, or maybe not. I actually don't know the answer to that, but he wasn't able to work with me. So he pointed me to Valdosta as a robust plan for reopening. So I went there to see that. And that's where we got the first sense of those bottlenecks that you're talking about, Holly. And, you have patients in the parking lot, you have the phone ringing off the hook, you have staff down 80%. I think that practice went from 42 staff down to 9. And if I'm not mistaken, 5 doctors down to 2. But the pent up demand for service was still there. So, they were trying to find the ways to channel communication such that they could find a workflow. And it really relates to space, prior advance notification, and, a plan to put into action. And it's different for every practice.
Eric, it is good to hear, though, that you're seeing that pent-up demand. But I agree with you, and what Holly said earlier. I think it's important to get your systems in place first, and not pretty much just open the door, free flow. Make sure that you feel comfortable with that. Certainly, what I've noticed in our experience is let's get the systems down. Let's let it trickle in at the beginning. Make sure we're comfortable with things, because once we start to get more of the volume, it's going to get a lot trickier.
Howard, I would agree with that too. I think that the example that I gave that I visited on Monday, they mentioned the same. So they had been open through the entire self-isolation period for critical care. And it really allowed them to sort of test and learn, because they did have patients coming in. So when they did reopen, when we went to phase 1 here in Florida, they could open their doors and start to see just more routine patients and consumers walking in off the street. They were ready. So that time gave them an opportunity to really get some protocols in place, test and learn from having patients walking through the door. And even still, when they did open the doors, they saw bottlenecks. So I think it's a great point that you're making, that there's a warm-up period that's probably required.
Yeah, I think you're absolutely right. And this is probably a perfect opportunity for us to welcome in our very special guests today, who can help give us some insights into how they're making their way back in their businesses, and I think it'd be very helpful to us. So it's my pleasure to welcome to the show Neil Blumenthal. As many of you know, Neil is the co-founder and co-CEO of Warby Parker, and along with him is my colleague, Pratil Lau. Dr. Pratil Lau. Dr. Lau runs the optometry side of the house for Warby Parker, and just a pleasure getting to know Pratil over this past year or so. He's a true quality practitioner, really trying to do the right things out there and bring great care to the Warby Parker network. So Neil, we'll start with you. Welcome. Neil and I actually have gotten to know each other back in our Vision Spring days. But Neil, we all admire what you've done. I got to say, man, you know what? You have made glasses cool again. And I think that is a really good thing for everybody. And we respect what you've done. Look, you know what? When people come to an industry and disrupt things a little bit and do it differently, there can be some, rub that the industry has against that. I would say everybody knows that you've just done an outstanding job. You've been creative. You've found ways to uniquely dispense eyewear in a way that is just so different than we've ever looked at before. And candidly, we've all learned from you. So welcome to Inside Vision, Neil and Pratil. We're thrilled to have you guys here.
Thank you. Thank you for having us.
You bet. Pratil, can you hear us okay? All good at your end?
I can hear you okay. Thanks for having us, and thanks for the kind words in the beginning there, Howard.
You bet. And thank you for waking up early out on the West Coast. We appreciate that. So Neil, Neil, I think, people would really enjoy, hearing from you a little bit about how you've led and kind of managed this road back. It's a challenge. There's no question. We set up the front end of the show. Closing was easy. It's the opening side that is really the challenging part. And I think people would be interested to know, how have you led through this? What have you done? What have sort of been your guiding principles as you come back, and maybe give us an idea of what that process has looked like so far?
Sure. Well, I think to start, right, if you need to radically change how you lead and what you believe in times of crisis, you're in trouble. So we've really looked back at our core values and ensure that in this really challenging time that we're living those values. And that's how people are going to be judged. This is an incredibly difficult time for everyone, personally and professionally. And we need to make sure that we're all doing our best for our families, our best for our teams, our best for the community. So we spent a lot of time talking about our core values and making sure that we're living by them. This crisis has morphed. I mean, we were looking at COVID in the end of the year, in November, December. We assess it as primarily a supply chain production and transportation risk, as some of our frames are produced in China, some are produced in Japan. That risk started to grow, especially as the virus hit Europe, because we have some frame production in Italy as well. And then from a risk standpoint, we started to look at this not so much as just supply chain production and transportation risk, but actually as a health and safety risk for our team, for our customers, and then as a potential customer demand risk. If there were going to be shutdowns, if this was going to throw the economy into a recession or even worse. So we started planning for it, I think, much earlier than many others. And we started talking to global companies that had a presence in hard-hit areas outside the U.S. One of the things that you need to do in times of crises as a leader is over-communicate. So we start to change the frequency with which my co-founder and co-CEO Dave and I communicate with the team. We usually do a weekly all hands. We start to do it twice a week. We start to set people's expectations that this is going to be challenging. And we thought that it was also our role to be sharing what we're hearing from business leaders, from public health experts, from even government leaders, what they were saying behind closed doors, because frankly, what we were hearing as a general public was not sufficient to prepare businesses like Warby Parker or the general public for what was coming. So we thought it was our responsibility to be communicating that to the team. And quickly, right, the number one priority of any leader is the health and safety of their team, right? The thing is that doesn't get talked about much in the business context, because for most businesses, health and safety of one's team and one's customer is usually not threatened. And that all changed with COVID. So we started to talk about it a lot. We started to institute protocols. We quickly moved our retail stores to have guided experiences, and where we would disinfect frames before and after a customer would touch them. We then were the first national optical retailer to close all of our stores, and we were one of the first national retailers in the entire country to close all our stores, and that was in mid-March, and that was 100% the right decision. Yes, the virus has impacted different regions of the country differently, and certainly our home, New York, got hit really hard early and is still getting hit. Pratil is based in Seattle, got hit really hard, so maybe we had a good perspective and a good view into what was going on. But that was a relatively easy decision, as you mentioned, right? As a country, we didn't have a good handle on where the virus was, but we knew that it was out there and that it was spreading, and businesses needed to play a proactive role in stopping the spread. So we closed all 120 stores, and only now, right in towards the end of May, are we starting to reopen. And we've been looking, I've learned more about new case rates, hospitalization rates, fatalities, testing positivity rates than I ever thought I would know or would need to know. And we're looking at geographies, how, in simple terms, how bad is it? And is it getting worse? And then we're looking at things that we have complete control over. What is the layout of the store? What is the leadership that we have in place in that store? Is it a store that is outdoors in an outdoor lifestyle center or on a street versus an indoor mall? And have created a framework for when and where to reopen stores. And then we've completely revamped all of our operating protocols. I'm happy to chat about it as well.
Yeah, no, I'd love to hear it. First of all, a couple of key things from there. Number one, and I think it's a great message, is you have your guiding light, you have your priorities. Those have not changed. They don't change in difficult times. They stay consistent. And I think that's a really important message. I'm not sure all of us necessarily have those sort of priorities that we put together in our small entrepreneurial practices. Pratil, perhaps you could address on the optometry side a little bit. What are you guys doing in preparation? And I suppose because you have locations all over the country, as Neil mentioned, it's a variable depending on where you are, but overarchingly, what are you guys doing in preparation, particularly on the eye care and optometry side?
Yeah, I think that's a great question. Just about half of our locations have ODs, have doctors in them. And we want to make sure that our OD team are working in close relations with our retail team as well, right? Because as we have patients coming in, we've color-coded the floor as an example, so we know exactly where patients will be going. When they come in, they know exactly which color, which path to follow to go into the exam room. One of the things we thought that we want to, obviously, as Neil said, the safety, the priority of safety is the most important for us. And that goes to our doctors, goes to our patients, our customers, our store teams as well. So we've made sure that all our doctors are outfitted with the appropriate PPE as well. Neil mentioned earlier that we had started looking at COVID a little bit earlier, and we actually had moved a little bit faster on getting PPE, a lot of which we actually ended up donating as well to some needy folks in New York, essentially. But we have our doctors outfitted with PPE. We've updated some of our processes. As just an example, our doctors will now pre-screen patients the day before, with the thinking that the less time that they're spending in the exam room at such close proximity with patients, the riskier it will be. So our thinking is that we reduce the time that they're spending in the exam room, but trying to do as much as we can outside. So we have our doctors calling patients the day before. We screen them to ensure that they don't have any symptoms or any other issues around COVID, but we also make them aware of what the experience will be like when these patients come in, the color coding, wearing of masks and face coverings, what our doctors will be doing, but at the same time taking a detailed history as well too. We also incorporated something we were working on, but we accelerated, was our virtual vision consultations, which is a telemed platform similar to what we're doing right now, chatting on video as well too. So we're allowing our doctors to make a clinical decision on whether someone who might be maybe more at risk of COVID, maybe something with COPD or something like that, would it be better for them to actually go through virtual vision consultation rather than coming into the store, and then increase that risk as well too. We've also accelerated some of our processes around our EHR as well too, so ensuring that our patients can actually fill out intake forms from home as well. Again, saving time when they come into our locations, but also it's one less surface to disinfect on the iPads, on the tablets as well too. And then on the exam side, we've provided and will be providing additional training around infection control, some of it very well supported by NECO. So thank you very much for the support there that you provide to all the ODs with the programs they've been putting on with Dr. Chu. And at the same time, just really ensuring that our patients are really aware of everything that we're doing, trying to keep them safe as well.
Thank you, Pratil. I appreciate that. I think
Howard,
yeah.
Yeah, I was just curious because I think we just made a really important point, and so critical to think about the communication aspect through reopening with patients. So would love to explore that a little bit more, because all of what we've talked about is how important it is to keep the safety of our employees and obviously our customers or our patients top of mind in everything that we do, and that's a relatively new phenomenon that we're facing. So I'm just really curious for you, Neil, and Pratil as well, what steps you've taken, and maybe we can articulate for the audience to ensure your customers, when they come back, that they will be safe, that there is a process. I noticed the website, has been updated. You talked about phone calls in advance of visits. So maybe just elaborating a little bit more to give us a protocol would be really helpful.
Sure. And I'd probably lead by sharing our philosophy is you do not open unless you have a really robust plan in place that you are fully confident in. That's not to say that those protocols can evolve and get better based on feedback from experts and your own learning. But this is not something that you just want to be learning as you go and winging it, right? The stakes are way too high. So for one thing, we're practicing social distancing. So we had our store design team look at every single store, and we've completely changed the layout of those stores. We've put vinyl markers on the floor to demarcate 6 feet distancing. We've created separate sections so that way people can shop away from one another. We're limiting traffic into the store to ensure social distancing. When somebody comes in, they're greeted. If the store is at capacity, which is often just a few people, we're entering people into a wait list and texting them when it's time to come back. And in fact, we're encouraging them to download the Warby Parker app because they can use our proprietary virtual try-on and actually sort of start to browse frames even before they enter the store. Similarly, right, we're ensuring mask wearing of our employees and mask and face coverings of our customers and patients. We're doing health screenings and temperature checks of our team members on a daily basis. And of course, cleaning and maintaining the highest levels of sanitization and having hand sanitizer and hand washing stations available to everyone.
A lot of good work you guys are doing there. Eric, are you out there? You're hearing us okay? Eric, are you there?
Yes. Yes.
Yes,
okay.
Great.
Yeah, hey.
Hey, buddy,
yeah,
listen, I was just going to ask you, Neil was just talking about some of the painstaking efforts that Warby is making to assure their customers and their employees are safe. What have you seen? Have you seen a difference in terms of some of the businesses you're going into, some of them, doing just what Warby Parker is doing and being very cautious, and others not so much? Or are you seeing good consistency in terms of how things are looking with regard to retail businesses?
Well, with regard to retail businesses, you have a variety. The restaurants have a wide variety. You can sit down and eat at some restaurants. I was on Fifth Ave in Naples a week ago, eating, on the sidewalk with hundreds of people walking by as if it were an absolutely normal day. Across Alligator Alley the next morning, where it looked like a war hospital. Face shields, temperature check at the door, very tight, hard to maneuver space with only one access in, so patients waiting outside, and just really strict protocols there. So the disparity between the perception and the operation in medical, I'm noticing, is vastly different than what could be next door at a restaurant. But at the same time, you're working up close with your patients. There is that exposure. I think it's really a situation of context and how to prepare for the reopening.
Right, but I have to believe, and Neil, I assume you believe it because you've done this, that the consumer is going to feel a lot more comfortable coming into businesses that have taken the time and the effort to make these adjustments and changes. I mean, I know personally for me, I'm looking for those things today. So, and maybe jump in just a little bit, but relevant to this topic, Neil and Pratil, I'm curious as to what you think we're looking at with regard to utilization. We know a lot of people have been furloughed, a lot of people are out of work and are on unemployment. How are you guys looking at the sheer volume or the utilization that you're expecting over the next, let's say, 3 to 6 months? Maybe Neil, you can start, and if Pratil has anything to add on that.
Sure. Well, for one thing is that we can learn from countries that are farther along in the arc of this crisis, like China, Korea, Taiwan, Singapore, Japan, and many retailers that have reopened, all right, are reporting being down 20 to 50%. Now, those are also areas that took way more robust action to control the spread of the virus, and have far more robust public health surveillance measures in place, more robust testing. So that all gives consumers confidence to resume activities and reduces the risk of a second and third wave that we're very concerned about. All the measures that we're putting in place, we gives our teams confidence, they give customers confidence. The transmission of this virus is happening indoors. So it's really important that we're the most careful when we're doing activities indoors, and particularly shopping or seeing doctors. In the early days of this, we saw really disproportionately high infection rates around eye doctors, dentists, ophthalmologists, you name it. So we've been trying to rethink the entire experience to reduce the amount of time that somebody needs to be in a small room in close proximity. How do we reduce oral communication as well? So we're doing intake forms to get as much information as possible. We put in place contactless payment as well to reduce as many of those interactions as possible to get people in and out quickly, but still having an exceptional experience.
That's
fantastic. I have a question. Sorry, Howard. One of the areas or flows within a practice or a business like yours where there is the most interaction and the most touching, if you will, and is the actual try-on process in the office of frames. And that was one of the things I had mentioned up front that seemed like it was a pain point for the practice that I was in, that obviously, people want to see how they look in the glasses they're trying on once they've been touched by the patient, what happens to them next? And have you worked out, in your view, what that flow looks like to keep those products sanitized, but still keep your customers engaged in the buying process?
Yeah, so we actually did this before our store closure, and then it's certainly a component as we reopen, and that's we're only doing guided experiences, meaning that a sales associate is accompanying the customer and is the one taking glasses off the shelf, is using an EPA registered disinfecting wipe to disinfect the frame, handing it to the customer, and then disinfecting that frame and before putting it back on the shelf. So frames are being cleaned twice before any customer touches them. And I think that that's really important. One of the things that happened literally days before we closed nationally was we got a call from a customer that said they just tested positive for COVID and have been in our store, a couple days earlier. What we immediately did was identify the person, knew what time they were in the store. We were able to look at the video that we have in the store, and we're able to see that our sales associates followed the protocol and were disinfecting the frames, every frame that this person touched, and that the person didn't come within 6 feet of any other customer. So we were relieved that our protocols were being followed. And of course, we shared that with the rest of the retail team to explain how important this is to follow these protocols.
What a great example, really, to show of how it truly works. I assume none of your other people came down with COVID-19, which is the good news part of this story, I suppose. But to show that, listen, you do follow these protocols, we do the right things, we do minimize the risk, and that's a great reinforcement for what you're trying to do. So, Pratil, before we go any further on this, and just quickly weigh in, if you don't mind, on what you're thinking about the volume and the pent-up demand for the eye exam side of things. Are you guys seeing that? Do you feel like that you will be ready and that there will be people ready to come back and get their eyes examined? What are you seeing so far?
Yeah, I think from an eye exam perspective, certainly seems like there is a pent-up demand. I think, eye care services are one of those that are relatively sticky and relatively safe from a from a recession point of view. What we have done, though, just again to be on the safe side, is we've, to start off with, what we've done is only have exams at the top of the hour. So basically an hour between exams, and it allows our doctors to make sure that all the systems are working. It allows them time to make sure that they're disinfecting the entire room in between. We will likely lessen that a little bit as time goes along, as we test out the systems, make sure everything's working, and continue to evolve that. But based on that, it does appear that there might be a pent-up demand for exam services. It's difficult to predict how 3 months and 6 months look like, because I think the thing that keeps us up at night is definitely whether there's going to be a second wave, whether we, and by we I mean, all the governments, state governments, federal government, have done enough in terms of actually making sure that that we have all the cases in the downward path, and that it's not going to come back again. So I think it's going to be difficult to predict. I think there will be other things in play, what the economy is doing, what the consumer confidence is like, how quickly jobs come back as well too. So I guess short answer is don't have an answer for you, Howard.
Well, that was a pretty good answer for not having an answer.
Yeah.
I'm curious, Howard. I'm curious if we can switch gears and talk about business results and the importance of digital and online.
Check. Hey guys, can I come in for a second?
Sure.
Can I come in for a second?
Oh, sure.
Sorry,
Way
Holly.
more interesting than what I was going to ask.
The fuzz went away, and this young lady came by and had something to say. What do you have to say?
Well, I am a resident of Palm Beach County. I'm a U.S. citizen, and I am a voter. I am outraged by, typically liberal media is usually covering people. They're following them down to the beach to tell on them. When we have civil liberties, and I am a constitutionalist, and I believe that we should have the ability to use our beaches. So I'm happy if you guys are covering the opposite, because I vote for freedom, and I am going to vote against any elected official that does not defend and protect the U.S. Constitution. My name is Candace Rojas. Thank you.
Wow, Eric,
Candace.
thank you for interviewing Candace. I think it's similar to what we
I didn't interview her. She did. She demanded to
She
speak.
just jumped right in.
Yeah.
But it's a little like we talked about at the top of the show. You get these real dichotomy that exists right now. People, you can tell passion in her voice. She really believes it, and you'll be able to run into somebody else on the street who will have just as much passion for the other side of this. And I think it's what makes it even more challenging for a retailer like Warby Parker and private practices like we have and other retailers to truly find that happy medium and find that good balance. And I think Neil stated it really well. You have to, in your heart, believe you're doing the right things for your people, and you're protecting your people. You're protecting the people who come in. I don't think there's any wavering on that. And clearly we heard that from the Warby Parker team. But thanks, Eric. We appreciate that. We're going to go back to Holly. She was on.
I think I was just tagging on to some of the conversation around trying to forecast or predict demand for the second half of the year. I mean, obviously the first quarter of the year probably started out quite well for lots of folks, January, February, and then March took a turn. Second quarter was extremely challenging, far worse in some industries than in others. And now we're trying to reforecast demand for third and fourth quarter to figure out. And I'm just curious, again, the outlook coming out of second quarter, where it was so challenging, being closed for so many, the importance of digital and online for Warby Parker and what that meant for results. Because I think that's a really important learning for us as an industry, putting digital first in terms of our strategies and really making that a priority throughout the patient journey. So curious, Neil, to get your perspective on how digital enabled your results in the second quarter, despite all of what we've talked about.
Yeah, so I think crises like this accelerate existing trends, right? And they accelerate them significantly, like probably faster than 3 to 5 years, right? And whether that is around distance learning, whether that's around telemedicine, whether that's around e-commerce penetration, in some categories, e-commerce penetration was already super high, but right after this, all these trends that we're seeing, it's just going to continue to accelerate, and in particular with the sale of glasses and prescription glasses and sunglasses and contacts. When we started Warby Parker in 2010, online penetration of prescription glasses was less than 1%. As of last year, we think it was around 5%. We're a big chunk of that and one of the driving forces of that. And if you had asked me 10 years ago, what would online penetration have been 10 years later, I would have thought that it would have been double that, closer to 10% than 5%, especially when you look at other categories like apparel or accessories. Now, this no doubt will accelerate the trend of going online, and Warby Parker being pretty much the only top 10 optical retailer to have a truly robust and comprehensive e-commerce presence has definitely helped us weather this storm. In the first couple weeks of this crisis, when it was at its peak, sort of the end of March, our e-commerce was generally trending as it had been in the beginning of the year, but then every week since that, growth has accelerated as people have been looking for other options and unable to go into our stores or into other practices, and optical shops have been coming to us online. So we've even seen a higher percent of our customers being first-time buyers and new customers. I think the future is digital or some combination of physical and digital, right? Our shopping experiences, our medical and healthcare experiences are no different than any other aspect of our life, which is both lived physically and digitally.
Absolutely. So I'm just really curious. So I'm an independent practitioner, let's say, that hasn't really developed out what my digital capabilities should be or can be yet. So I haven't gone there yet. Now COVID strikes. I see the importance for moving in that direction. And there's so many different places you can start, right? I mean, you can start in terms of your communication approach with patients. And using social media and your website or CRM practices there. You could build out a web platform like you did very early on and transact in terms of eyewear. You could look at telehealth, for example. So there's so many different options. Do both of you have any advice for independent practitioners on where to start first?
So I think with all things, it always makes sense to start with the customer and how do you create a better experience for the customer. I think it's going to be really hard for the independent practitioner to build a robust e-commerce business, just in terms of access to capital and expertise. I think that's really challenging. But to start to layer in some sort of digital experience to their existing experience would make sense, whether that, and some of that could be relatively low tech, calling in advance, triaging folks, seeing how you can do video chats early on, figuring out ways to prepare people for their visit into the store or into the exam room, and making it as efficient and as enjoyable as possible. I mean, one thing that's for certain, everybody has spent a lot more time at home during this crisis, and has figured out different ways to get things done. And yes, people have cabin fever and they want to get back out there, and they will, but they're also going to really appreciate all that additional time that they had at home and with their families and talking to their friends potentially, or watching Netflix, whatever show it is. So we as practitioners are going to need to respect that and help make the experiences more efficient for folks in the future.
Well, thank you, Neil. Appreciate that very much. Pratil, maybe as we start to wind down, unfortunately, and I wish we had another hour with you guys, but as we start to wind down, what is it you would want our colleagues to know about Warby Parker, Pratil? I think, you've been in the mix of it. You had a chance to work with these incredible entrepreneurs who have just really redefined the space in so many ways, but having an opportunity right now to talk to our colleagues, what would you like them to know about Warby Parker?
Absolutely. I think there's several things that I'd love for them to know about Warby Parker. First of all, I think Warby Parker has been phenomenal to our ODs. We have a extremely high employee engagement index with our ODs that they love working for us. They tell us one of the reasons for that is the fact that we don't determine their clinical decisions. We let them decide on what's really best for the patient. We don't, for our ODs, have targets that are based on sales and things like that. So it's very much respectful of the OD's clinical decision making. I think the other thing that's really important is realizing that technology is changing at a fast clip. And I've had the privilege of having worked with different professions, pharmacists, nurses, in medicine, and I think it's a profession we are lagging behind in terms of embracing some of this technology. And one of our biggest fears is that if we don't embrace some of this technology and make sure that it's helping us help our patients, I think it's a profession we run the risk of being irrelevant 15, 20 years from now. And I think I see Warby Parker as being really well positioned to take care of these patients. Hopefully we can do for eye care what we've been able to do for eyewear and make it more enjoyable. We have millions and millions of people out there that have not had their eyes checked in years, maybe ever. And that's something that I think will be able to change as well long term.
Well, I think you have some good aspirations for what you're doing. And Neil, I think you got the right person in place to make that happen for your team. So Neil, I'll throw the same one to you. What would you like people to know about Warby? And then perhaps maybe if you wouldn't mind adding, I know you're a philanthropic guy. Warby has been incredibly a giving organization to so many in the New York area and beyond. And perhaps you can quickly comment on that as well. Why is philanthropy important to Warby Parker and to you?
I guess just simply it helps me sleep at night. It's funny when Dave, Jeff, Andy, and I were working on the original business plan, right? We wanted to build a business that we were going to be excited to come to work every day and not roll over and hit the snooze button. And yes, there is a sacred duty of providing vision to folks and giving them glasses that help people function in their everyday lives and providing primary eye care. But we also recognize that there's just so much need out there. So we need to do our part to provide glasses. We've now distributed over 7 million pairs of glasses to people in need around the world. COVID has certainly changed every aspect of our business. And in a short duration, we've been providing a lot of PPE to frontline health care workers, and we've been speaking to some of our nonprofit partners like Vision Spring to see how we can also provide PPE to frontline health workers in other parts of the world. And this was something that Vision Spring sort of brought this idea because they have a lot of people on their team that have dealt with crises like Ebola outbreaks and were part of SARS and MERS mitigation efforts. And if we think that there's a PPE shortage in the United States, that shortage is tenfold in countries like Bangladesh and parts of rural India and sub-Saharan Africa and parts of Latin America. So we need to not only think locally, but think globally as well. In terms of what I would love people in the optometry community and the broader optical community to know about Warby Parker is that we care about our team and we care about our customers and our community. Our guiding principle, as I mentioned earlier, was the health and safety of our team and our customers. Quickly after that, as this really became clear that this was not just a public health crisis, but a financial and economic crisis, it was how do we pay our team members as much as possible for as long as possible without sort of damaging the viability of Warby Parker as a going concern. Now, thankfully, there's not a risk of Warby Parker not being a going concern, but in those weeks in March, right, and the beginning of April, right, the stock market was falling at levels never seen before. People are talking about a depression, right? We had to do everything to, like every business, to make sure that we were managing cash properly and doing things right. But throughout this, We've ensured that our optometrists are paid in full, even though our stores and exam rooms have been closed. Our store teams, we've guaranteed that they'll have full payment to what they were earning before, even while the stores have been closed. So we've been trying to do a lot to protect our teams, not just from a health perspective, but from a financial perspective as well.
I could see why people enjoy working for you so much, but that's not an easy decision to make, by the way. And I think you're, again, getting back to your priorities and what's important to you, and you seem to be very consistent with that. And I'm sure people around you appreciate that very much. Unfortunately, we're kind of winding down and we're running out of time. But very quickly, gentlemen, if you don't mind, what we like to do at the end of every show is sort of offer up suggestions on any readings that you're doing, any reference materials that you have found useful through this particular period of time. I've had a lot of great suggestions that I've been working on since we started this show. So Pratil, we'll let you get the first word on that. Any suggestions on anything you're reading or any reference materials that you think would be helpful to our listeners?
Absolutely. I can actually think of two. I think, great books have a way of speaking to you, especially when the time is right as well. So one I'm reading right now is by Bob Iger, the Disney CEO. It's called Ride of a Lifetime. It's a fascinating read. I'm not one for biographies, but this has a lot of business lessons and lessons in leadership that I've been enjoying. And the other one that I just read prior was Grit by Angela Duckworth, which I think is a phenomenal book about success and the science behind success, and especially what to do when you're down but not out. And the success is determined by how well we come back, as opposed to some type of ingrown genetical benefit or something of that nature. So both are fascinating reads. Certainly recommend those.
Thank you. And Neil, we'll throw the same one to you.
Sure. Well, if people are looking to understand more about the crisis, I've been spending a disproportionate amount of time on a few websites, including the Johns Hopkins Coronavirus Resource Center, another website, covidexitstrategy.org, another one, endcoronavirus.org. But I've also picked up Adam Grant's Give and Take. And the premise of that book is that the best thing you can do professionally and personally is ask somebody else, how can I help? And to be a giver rather than a taker. And if there's ever a lesson that we need in a time of crisis where communities are the most vulnerable are suffering right now, it's lessons like that.
Thank you. Wow, what a perfect way to end on that message. And thank you guys for the insights. Holly, before we close it out, I want to say thank you to you. A couple weeks ago, you made an offer to our listeners to give them 30 minutes of your time to work with you and to try to work through some of the challenges that we're all facing today. And I think those lucky individuals who had a chance to spend some time with you, I've heard from some of them. They appreciate so much the time that you've given. I want to thank you for doing that. I hope it's been a good experience for you as well. I assume it has.
Yeah, it's been amazing to be part of people's journeys, especially right now. There's just so much happening in the world around us, and people's minds are very busy. And whether that's around, career transitions or just like we talked about today, business challenges that they're facing, they need someone outside of their day-to-day to talk things through with and to come up with solutions that many times they already had. So it's been incredibly fulfilling. I've had the chance already to speak to almost 30 people. That was my goal, 30 in 30 days, and to see where that journey took all of us. And it's just been nice to expand my network and get to know so many people as a result of that, and to feel like I could do something for them.
Well, thank you, Holly. And I know, as I said, they appreciated it very much. The feedback has been incredibly positive, and what a great example of giving forward and giving back that you continue to do in this industry. So we thank you very much for that. On behalf of Eric and my co-host, Holly, I want to thank Neil and Pratil for their time this morning. Incredibly valuable. It's so clear why Warby is successful. You guys are so committed to the business, committed to your people, and I think it's a great message for all of us. So we look forward to seeing everybody next Wednesday morning at 9:30. And before we close, we'll go to our usual. I want to thank Dr. John Rampakis, and we'll give you something to think about.
Addressing and dealing with situations like reopening requires innovative approaches for sure, but not everything always needs to be new. If you start to think about tried and true business principles that you've applied, things like establishing your mission and your vision statements for your companies, those are the things that really guide you through both good times and bad. Take the team at Warby Parker. They're not in the ophthalmic field as optometrists, right? But they're leading a very successful ophthalmic business. Why? Because they have the courage to make tough decisions when tough decisions need to be made by applying solid business principles. If we think about those solid business principles, when I provide consulting services to optometric and ophthalmological practices, I oftentimes look outside of the eye care world for business ideas. I look to companies like Starbucks, Microsoft, Google, Facebook, companies that are innovating, leading new ways to lead their people to achieve what they want to do. It's important that you recognize that just by making an objective, dispassionate decision about something in your business doesn't mean you have a lack of passion for your business. In fact, it's just the opposite. You're making the hard decisions and the right decisions because it's what's going to guide your business to the next point. Over the years, I've developed one little saying that I like to share with people, and I call it the 4 I's. It's not just having good intentions that allow you to do things, but it's the ability to be able to integrate those into your business and implement those effectively. Only by doing those 3 things are you going to be able to really make an impact on both your practice, your patients, your team, and on yourself. I'm John Marimpakis, and that's something to think about.
Thanks for watching Inside Vision. To receive updates about our programming,